So what is it like to be infected with COVID-19? My next guest is documenting his battle against the virus. Dr. Yale-Tung Chen is an emergency doctor at Hospital Universitario La Paz in Madrid, Spain. The 35-year-old got infected while treating patients at his hospital. He's been sharing his experience on Twitter and joins me via Skype from Madrid. Dr. Chen, thank you so much for coming on the show. It has been 8 days since you got diagnosed with COVID-19. How are you feeling?
Thank you, George, for your invitation. My feeling is that this disease is no more than, in my case, which is a mild case of coronavirus infection, is no more than a common and regular flu infection.
And what were some of the symptoms that you had early on, Dr. Chen?
Was a dry cough, weakness, low-grade fever, and especially a headache at the beginning.
And you said that, you just mentioned that in your case that this was nothing more than, a flu for you. But for others, it's in some cases, it's not that case, right?
Yes. Actually, I belong to that 80% of the patients who got mild symptoms. And that's because I'm young, I don't have risk factors and any other illnesses. And that is why I got, I'm going to have, the prediction is that I'm going to have a mild outcome, a good outcome.
You have a wife and 2 children. Are they infected? And what's been the hardest part of your experience?
They are not infected. They did the test and came up negative. Right now, they are with some relatives outside here. We wanted to avoid as much as possible any risk of infection. So as soon as I got the negative result, I asked them to go with other relatives to stay.
I assume you are there in quarantine. Many people, Dr. Chen, around the world are feeling the strain of the virus as new cases are being reported. What's your message to those who feel fearful or are panicking?
Unlike any other disease in history, in 4 months since the outbreak started in China, in Wuhan, it's being put in a lot of efforts to know this virus, to know how can be this virus treated, who are the vulnerable population to this virus, and all the outcomes. So it's not anymore an unknown virus. We know what we need to do and how to treat it. And that's the message I want everyone to have, to stay calm, to follow all the instructions from the health ministry, the government, and to try as much as possible any social contacts. This virus is transmitted from person to person. So if you belong to the risk factor population, if possible, you should avoid any unnecessary contacts.
Real quickly, you are a Christian. How is your faith carrying you at this time?
It means everything. I mean, I wouldn't stay that calm, or I wouldn't be. It wouldn't be reassuring to know that my wife alone has to take care 2 kids and everything else around her, if it wasn't because of my Christianity. I know we will have that pillar supporting us in all this long journey that we're facing ahead.
Yeah. And we were just showing viewers your Twitter handle. You have gone to Twitter to help others understand what you are going through. Dr. Chen, thank you so much for coming on the show. You can follow Dr. Chen's recovery. His Twitter handle is Yale-Tung. Dr. Chen, thank you so much for coming on the show.